NBC5 News at 6 starts now.
New tonight, NBC5 News is kicking off a three-part special report about a very serious issue impacting our community and many others across the world. Good evening. Thanks for choosing NBC5 News at 6. I'm Jenna King. Andrea Boyd will join us in about a half an hour. The last 6 months, you've heard us use the phrase drug diversion countless times. Tonight, only on NBC5 News, our medical expert, Dr. Robin Miller, breaks down what it is exactly, where it's occurring, and what we all should be aware of to help prevent it in the future. That's our top story tonight at 6.
Hello, I'm Dr. Robin Miller. I want to discuss something many of us have become aware of recently due to the unfortunate alleged occurrences at our local hospital. That something is diversion. What is it? The word has many meanings depending on the context. When it comes to roads, cars may be diverted if there's road construction. When rivers pose a threat to a community, their flow may be changed or diverted. In medicine, it's the distribution or abuse of drugs for purposes not intended by the person prescribing them. This is something that can happen anywhere along the way the drugs travel. In other words, drugs can be hijacked from the manufacturer, or can be taken from a pharmacy illegally or diverted from the patient who they're prescribed for. This is a problem that's not isolated geographically. It's happening nationwide. It also appears to be happening locally. As KOBI has reported, a nurse allegedly diverted intravenous fentanyl and substituted it with tap water. Allegedly, numerous patients have been injured or have died as a result. What can be done? Medical systems need to assess harm to patients, consult with public health officials if tampering with injectable medication or illegal distribution of tablets are suspected, and promptly report them to law enforcement and other enforcement agencies. But the medical institutions aren't always paying attention. As an example, in 2013, a nurse and a physician were found unconscious in a hospital bathroom at the University of Michigan Health System. Both had overdosed on diverted opioids. Resuscitation was attempted. The doctor survived, the nurse did not. Investigations found that diversion had been going on for years. Up to 16,000 tablets of oxycodone had been diverted within the University of Michigan Health System. The University of Michigan agreed to a $4.3 million settlement. Unfortunately, this is not an isolated example. There are multiple examples of drug diversion with the consequences of patients suffering, developing infections, and even dying. It's clear there's much to be done to tackle the problem. This is not just nationwide, but worldwide.
Dr. Robin Miller reporting. Tomorrow night in part 2 of this exclusive NBC5 News report, Dr. Miller will explain just how widespread drug diversion. In continuing coverage.